When we talk about spinal tumors, we mean neoplasms that arise in the area of the vertebrae and/or spinal cord. They can grow in different layers of the spinal canal. Extradural, epidural, in the bones of the vertebrae or in the epidural space, which is located between the bone and the dura mater. This type mainly includes metastases and primary bone tumors. Intradural extramedullary, within the dura mater, but outside the spinal cord tissue. Meningiomas and neuronomas are most common here. Intramedullary, directly in the spinal cord tissue. Among the most common are ependymomas and astrocytomas. Spinal tumors usually make themselves felt with three types of pain syndromes: biological pain, night. As a rule, it is an early sign of most spinal tumors. The pain most often occurs at night or early in the morning and disappears after the start of physical activity. It is believed that it is caused by the action of inflammatory mediators produced by the tumor. Mechanical pain, caused by a fracture of the vertebra affected by the tumor. It is noticeably worse during movement or physical activity. Due to damaged bone tissue, any load causes increased pain. Radiculopathy, radicular pain. It occurs due to compression of the nerve roots and is manifested by pain that spreads along the affected root. It may be accompanied by a tingling sensation, numbness, and, with a long period of compression, muscle wasting, atrophy. Neurological disorders may also develop, indicating damage to a specific part of the spinal cord. Typical examples include spastic weakness, urinary incontinence, and sensory deficits, both in individual sensory pathways and in all of them below the level of the spinal cord lesion. These deficits usually occur simultaneously on both sides of the body. Magnetic resonance imaging is considered the main method for diagnosing spinal tumors. It is the one that best visualizes the structure of the spinal cord and its membranes, determines the location and size of the tumor, and the degree of compression of the nerve elements. The following symptoms and signs may suggest a spinal cord tumor: progressive or unexplained back pain, particularly nocturnal, so-called biological, or radicular pain, segmental neurological disorders, neurological deficits that suggest spinal cord or radicular involvement and have no apparent cause. Back pain of unknown origin in patients with a history of cancer. Treatment of spinal tumors usually consists of several important components and depends on the nature of the tumor, its size, location, and the patient's general condition. The main approaches can be divided into emergency therapy for life-threatening symptoms and planned treatment aimed at long-term control of the disease. One of the primary tasks is to reduce spinal edema and prevent irreversible neurological damage. High doses of corticosteroids are often used for this purpose, especially when there are signs of acute spinal cord compression, progressive weakness in the limbs, sensory disturbances, urinary problems, etc. Rapid corticosteroid support allows time for additional examinations and planning of further tactics. Surgery is mostly indicated when it is necessary to eliminate pressure on neural structures or stabilize the spine. Some primary tumors, for example, osteosarcomas or chondrosarcomas, can be radically removed, provided that their localization is clear. In the case of metastatic lesions, surgery is often combined with other methods, such as radiation therapy or systemic treatment, depending on the sensitivity of the tumor.